Okay, so another session. Today we are going to talk about what is behavior. And for those of you who joined us last week, we did touch on a lot of behavioral concepts, how to record data. And Ashley and Mary last week briefly touched on ABC data recording, which we will talk in more depth for next week's session. But today is still kind of our topic revolves around behavior, and I will kind of go through some of the goals that we have lined up for today. So again, this is a 60-minute Zoom session. We try to keep it at 60, but sometimes the conversation is so great, we bleed over, but that's okay. If you all are cool, we can always stay back and answer questions. So today we have Lauren Martone. Lauren holds a master's degree in clinical psychology, and she is currently doing her doctoral degree in school psychology at the University of Utah. Lauren provides individual teletherapy to children with behavioral and mental health needs through the university's Technology and Training Education and Consultation Lab, which is the UT Tech Lab, which kind of hosts and facilitates this webinar series. Lauren does a lot of great things, but she's mostly interested in the design and dissemination of practitioner-friendly behavioral interventions, which is super interesting and a unique interest for sure. For those of you who are joining today, I am Chat. I am a postdoctoral fellow in the Department of Ed Psychology at the University of Utah. My background is in school psychology, and I graduated from Mississippi State. I've worked with children with disabilities and without disabilities, really on various behavioral concerns, and really supporting children, not only in clinic settings, but going into the schools and helping them with academic and behavioral challenges. So for today, this is what we have lined up. We will kind of focus, keep the conversation about behavior going, because I think that is super important. It has several layers and it has several perspectives. So I think it's really important to have this conversation going about what is behavior and really understanding behavior. But to supplement that, it's also important to know what is not a behavior. And that's again something that Ashley and Mary last week they spoke about. So we are kind of going to go more into depth about kind of the differences between behavior and non-behavior. In that conversation, we'll also talk about labeling behaviors. How do you define behaviors? How do you define what you see? And also, how do we track the behaviors that we see? So here, we will be touching on more ways to collect data on what you see and on our kids' behaviors. So with that, I want to give one more reminder before I hand over to Lauren. So this link here that I'm going to drop for those of you who have joined us previously in the past weeks, this is the link to our raffle draw. So if you have been attending all of our past sessions, awesome. This is kind of how we keep track of who attends this session. So if anyone attends all of the sessions, you will qualify to enter your name into our raffle draw at the end of this series, which is mid-January. So do drop your information there without fail, because we want your names to be on that raffle for sure. Okay. So with that, I am going to hand over to Lauren to go ahead and get started on this fantastic presentation that she's made. And yeah, over to you, Lauren.
Thanks, Chat. Let me pull up my presentation. And all right, can everyone see that okay?
Yep, perfect.
Yes. Awesome. So thank you for that introduction, Chat. My name is Lauren, and it's seriously such a pleasure to be here with everyone tonight. I'm so glad you've all joined us, or maybe you're watching the recording. That's awesome too. And then also big thanks to Chat for organizing this. I think it's great to get the content out. So yeah, big thanks to everyone here. As Chat said, today I'll be going over what is behavior, which really honored to cover because it is so foundational to how we assess and how we treat kids. So I think this is great content. Again, some of it might be review or pretty basic, but hopefully this will be a good foundation for everybody in terms of knowing what behavior is. So I'll start by giving just a broad overview of what will be covered tonight. As Chat mentioned, we're going to start with what is behavior and what is not behavior. And then we're going to talk about how behavior is measured, how we define it. And then I'll be going over some types of data collection when we talk about behavioral data. So first, what is behavior? Might be a simple question. You know, we can all think of a lot of examples of behavior and we can point out behaviors when we see them. But I think it'll be best if we start with just a quick definition of what behavior is. So one definition we can use is behavior is an organism's activities in response to external or internal stimuli. So the first part, organism, that's just any person or animal. For this presentation, we'll be focusing on people, specifically kids. And then the second part is stimuli, and these can be external or internal. And a stimuli is basically just a detectable change in someone's environment. So external could be outside the person, or internal can be inside the person. And I'll give some examples here to make that more clear. Oops, sorry. Hear a car outside. So I'll have two examples. This first one is for external stimulus. So in this example, a teacher asks a class a question. That would be the external stimulus. There's a change in the environment. And then the behavior is the student might raise their hand. So we have an external change and a behavior in response. And then for an internal stimulus example, we might feel hungry or we might feel our stomach rumbling. And then the behavior in response would be eating something or getting something to eat. So again, we have this change in the environment or within ourselves, and then a behavior in response. So now that we kind of have that basic definition of behavior, it'll be easier to start breaking behavior down a little bit more into different types of behavior. There are many breakdowns, but one of the big ones is breaking it down into covert and overt behavior. So covert are things that are inside individuals themselves. Only they can experience them. They're happening on the inside. And again, I'll clarify in the slides to come. And overt behaviors are things that others can observe or experience. They're outwardly visible to other people. So now for some more examples. Covert behavior, again, that's that inner behavior. So it can't be observed by other people outside of the individual. Think like thoughts, feelings, emotions. These are things that are occurring inside the individual. Others can't see them, but they're still considered behaviors because they're still responses to stimuli. And then on the other hand, we have overt behaviors. And these are things that we typically think of when we hear the word behavior. So running, crying, hitting, chewing, talking, these are overt behaviors. They're things that other people can see because they're happening outside of the individual. And overt behaviors are really going to be the focus of assessment and treatment and behavior analysis because they're the things that we can objectively see and track and measure. You know, there's no guessing or rating or asking people what they're thinking. We're really observing whether these behaviors occur or they don't occur, which make them the kind of preferred behavior to work with in the case of behavior analysis. So now that we broadly know what behavior is, it's important also to quickly touch on what behavior is not. And one of the best ways to know what is not a behavior is called the dead man's test. It's a little unconventional, but generally, if a dead man can do it, it's not a behavior. So for example, not running in the halls, not yelling, not paying attention. These are all things that technically a dead man can do, and so we shouldn't really be considering them as behaviors. Instead, we can change them to things that do pass the test. For example, walking in the halls, talking at an appropriate volume, staying on task. These are things that a dead man wouldn't be able to do, and so they can be considered behaviors. Essentially, when we're trying to change behavior, we want to stay away from using non-behaviors. So instead of telling a child, stop running in the halls, it's more effective to say, walk in the halls, because then we're specifying what that actual desired behavior is instead of telling them to refrain from a behavior. So now we have the overall picture, what behavior is not. The next real challenge is knowing how behavior should be measured and defined. So as we know, some things can be objectively measured. For example, everyone measures height and weight pretty much the same way. We have the metric system. It's a very standard known system of measurement. For example, if I were to have everyone take the same brick and measure it and weigh it, we'd all come up with really similar, if not the same answers. However, a majority of behaviors and psychological concepts don't really have that standard unit of measurement or that standard system of measurement. So for example, if I asked you all to come up with a certain person's level of anxiety, we would all come up with like completely different answers. Maybe not completely, but we would have, just about as many answers as there are people here. Same thing with behaviors. If I asked you all to measure a certain child's tantrum behavior, some people would say it lasted 10 minutes. Some people would say there was really loud screaming or hitting. Some people say it happened during homework time. So there's this lack of like standard measurement when we're talking about behaviors and these psychological concepts. So to address this problem, we use operational definitions. And these are descriptions of a behavior in terms of how we're going to measure it. So in other words, you're going to give the behavior a certain definition so that multiple people can measure the same behavior and get the same results. I'm going to give some examples here just to show you all what I mean. Spitting. Spitting is one of those behaviors you know when you see it, but it still needs an operational definition to really remove any uncertainty about what counts as spitting. So the definition here is any occurrence of projecting matter or objects from the mouth, and it doesn't include drooling or saliva leaving the mouth during the course of eating. So here there are some really good distinctions made about what counts as spitting and what doesn't. And when you think about it, there are several times that like spit can leave your mouth, but we wouldn't really consider it spitting. And so those instances are important to include in the definition. So again, might be a pretty straightforward behavior in our minds, but you want to really have a strong definition so everyone is on the same page about what counts and what doesn't. The next one I have is biting. So same thing, pretty straightforward, but here we have it defined as any occurrence of opening and closing of the jaw with the upper and or lower teeth making contact with any part of a person's body. And again, we can point out biting when we see it, but there are some details here that make the definition stronger and more clear. Like, does it have to be all the teeth or just the upper or lower? Does there have to be contact? All of these things are really important to clarify in our definitions. So again, we can have the same number of occurrences when measuring something, no matter who's taking that measurement. It can honestly be kind of hard to come up with these operational definitions at first. I think there's definitely a skill to it, but there are some good tips out there to getting a good, reliable operational definition that'll produce the same results in terms of multiple people measuring a single behavior. So I'm going to cover a few tips here, but as you start making your own, you'll definitely start seeing like what works and what doesn't, what produces reliable results and what needs more work. But the first tip I have is making sure that it is specific. You want the observers to have to use as little judgment as possible. You want it to be very clear and leave little room for interpretation or uncertainty. The next is making it measurable. When you have a behavior that might last a long period of time or it occurs rapidly, there are certain cases when you're going to want to add some type of measurement unit on there. For example, you're in a classroom and a child might stand up out of their seat and it's not a big deal, but as soon as they move more than 3 meters away from their seat, then it's a big distraction. So you might want to include that 3 meters in your definition to say this distraction behavior is when he moves more than 3 meters from his seat. So sometimes it can be helpful to add that specific unit of measurement just to narrow down what you're looking for. And then also the next one is observable. This gets into our discussion of covert and overt behaviors. You want to make sure that the behavior is objectively able to be seen by others. So stay away from things like the child thinks or the child feels, and really stay focused on things that are, can be seen by others, those overt behaviors. And then finally, we have to make sure that a dead man can't do whatever our definition says. So it's a bit of a review of that dead man's test. We don't want any non-behaviors in our definitions. So now we want to just review some of these tips as a little bit of a practice of what may make a good operational definition. And so we're going to run some polls to kind of review these. So the first one is, which is a more specific definition of hitting? And remember, specific definitions leave the least amount of room for uncertainty, require the least amount of judgment. So, oops. All right. Okay, awesome. So most of y'all got it correct. It's B is the correct answer here. And essentially indicating that it can be an open palm or closed fist is more specific than just saying a hand. So maybe a simple example, a lot of y'all got it right, which is awesome. But again, just that clarification leaves less room for uncertainty and it makes it a more specific definition. So next we have, which is a more measurable definition of off-task behavior. Remember, measurable might have some unit of measurement to kind of clarify what we're looking for. Awesome. So again, majority of people got this one right, a little more uncertainty, but let me see. Got a lot of things going on here. Okay. B would be the correct answer for this one again, because it includes that unit of measurement, the 5 seconds or more. And again, that just leaves less room for judgment, and it will be helpful to have that so observers know at what point is the behavior considered off task. The next one is, which is a more observable definition of anxiety? So remember, observable definitions are going to use those overt behaviors. All right, so this one was a little bit tougher. The definition of A, child bounces leg up and down, that is definitely lacking specificity and maybe measurement, but it would be the more observable definition because it's something we can see. So when we look at the other one, which is the child feels jittery for more than 10 seconds, it's great that it has that measurement on there, but feeling jittery isn't something that we can see from the outside. And so the child bouncing their leg up and down is going to be something that we can see, and that makes it more observable. All right, so one more. This one is, which one passes the dead man's test? And remember, that's where we distinguish between behaviors and non-behaviors. All right, so for this one, the answer was A. So when we look at not running in the hallways, a dead man cannot run, but they can't walk. So A would be the correct one here because the child walking is a behavior, but a child not running is a non-behavior. So for this one, answer A would pass that dead man's test. Again, that is where we're distinguishing between behaviors and non-behaviors. So that's awesome. Thanks everyone for participating in that. So the last part of making operational definitions is adding examples and non-examples. This step is really helpful to show the observers what counts and what doesn't count as a behavior. So examples are behaviors that do fit under that definition, and non-examples are behaviors that do not fit under that definition. And when you're coming up with these, you might want to think of like commonly misjudged or tricky examples. So let me give you an example. So if the behavior is punching, we might have certain examples like they're hitting another individual with one closed fist or both closed fist. And for non-examples, they might be they hit another individual with an open palm, so it's more like a slap, or they attempt to hit with their closed fists and they miss. And the point here really, it's not to say, never count an attempt at punching as punching. You can absolutely decide to count that attempt as a punch. And that's up to you and your definition. The point here is to say that if you think of something that might be unclear to people who are observing, you definitely want to put those in your list of examples and non-examples. And this just makes it extra clear about what counts as an occurrence of a behavior and what doesn't count. And then also, I just want to mention that these aren't going to be the same for every individual. You could have two students who are being observed, and they might have two different definitions of what punching is going to be. So again, it's really making a standardized system for a specific behavior for a specific individual or a group of individuals. So finally, we're going to talk about how we collect behavior data. There are a bunch of different ways that we can collect behavior data, bunch of different types of data. I think next week y'all will be doing the ABC data, so I won't cover that here, but I'm going to cover a few that are seen more commonly. So first, frequency. Frequency answers the question, how many times does the behavior occur? So essentially, you're just counting the number of times the behavior occurs. Rate data answers the question, how many times does the behavior occur in a certain time frame? So you're taking that frequency count and adding some time component. And again, I'll give examples of all these individually too. Duration, that's going to answer the question, how long does the behavior occur? So you'll want some measurement of time. And then latency answers the question, how long after a cue or a prompt does the behavior occur? So how quickly or slowly does the behavior occur after the child's given a prompt or an instruction? So now I'll go into each in a bit more detail. Frequency data is again the number of times a behavior occurs. It's best for discrete behaviors, and I don't mean to throw another term at you guys, but discrete just means that they have a very clear beginning and a very clear end. Um, for example, biting, it happens pretty quickly and it's pretty clear when the teeth start and stop making contact. So that might be a good behavior that you would use frequency data for. It may not be the best choice of data when you have a really high frequency behavior that's really hard to keep track of, or behaviors that last a really long time. Like if you have a really long tantrum that lasts 3 hours, you're not going to want to say one tantrum occurred. You could, but that's not really a great gauge of the behavior that occurred. So, for example, a good time to use frequency data, for example, you go into a classroom and the teacher says there's a student who raises their hand all the time. It's excessive. And so you want to quantify how many times is this child actually raising their hand. And we're going to practice with this at the end, but essentially you're just counting how many times that child raises their hand, and that's the data that you're collecting. Next, we have rate data. And again, that's a mix of the frequency data or the count with the time period. And it has really similar guidelines as frequency data, where you want those discrete behaviors with clear beginnings, clear ends. And you don't want behaviors that are like too frequent or last a long period of time. For example, a mom might say, my child eats really slowly. It takes a lot of time away from other things. And I want to figure out, what's the rate that my child eats at. And so you might go in there and say, how many bites of food does this child take per minute? So again, you have that frequency count, you count the number of bites, and then you also have this unit of time, so you can get this rate of bites per minute. So they're really similar to, frequency and rate data, just this unit of time being added on. Then duration data. Duration is the length of time that the behavior lasts. And this is going to be best for behaviors that last longer, but they still need that clear beginning and clear end. Essentially, you're just going to be timing a behavior, so you need to know when to start the stopwatch and when to stop it. So defining the behavior with those operational definitions are going to be really important here, so you know when to start timing and when to stop, so you can get an accurate measurement. An example here might be a parent wants you, wants you to come in. They said their child throws really long tantrums, and you want to go in and see how many minutes and seconds or maybe hours does the tantrum last. So again, it's just this time measurement where we're figuring out how long things last. And finally, latency data. So this is the length of time between a cue and the behavior. So it does require some kind of like cue or instruction or prompt. And then also the behavior should have a clear beginning and end, or some indicator of being complete, so there's an accurate time measure. For example, a teacher might have you in and say that their student takes a really long time to get in line and transitions are taking forever. And so you want to figure out the latency between the teacher saying, hey class, time to line up, and the kid actually getting into line. And again, your definition is going to be really key here because it's a time measurement, and you might want to stop the timer when they get out of their seat, or maybe stop the timer when they're fully in line. So have that predetermined before observing, so you can get an accurate piece of latency data. So because frequency data is used so often, we're going to kind of focus on that as we wrap up our presentation portion by showing some data sheets. You're going to see several components of this data sheet. The first is going to be the student's name, and this is pretty simple logic, and just it's good to have an identifier on there, especially when you have a lot of kids you're observing. Really important to have the name somewhere on there, or initials, some identifier. And then the date. This is also kind of logical, and just that when you're tracking behaviors on different days or over a period of time, it can be important to have some kind of marker of the date on there to stay organized. Then operational definition. This isn't going to be found on every data sheet, but it is recommended to have the operational definition or just the behavior on the data sheet. So it's been really helpful to me to have that on there just so you have something to reference. It's visible right in front of you when you're recording data to remind you what you're looking for and what you're not looking for. Then we have time interval, and this can get a little bit more into the rate side of things where we're adding that time component. This isn't always necessary. You might just be recording for a few minutes or during a certain activity, but it can be helpful to have that time interval, especially when you want to show changes over time or see if things are occurring more at some times than others. Then this is like the big part, non-negotiable, super important part is the occurrences. And this is where you're going to put tally marks every time a behavior occurs. And then finally, we have the actual frequency. And this is essentially just a total column where you total all your tallies, all your occurrences, and then you add them all up and you get a frequency count. And that's going to be your frequency data that you'll be using. So now to kind of pull everything together, I wanted to do a quick video practice. If you have like a scrap sheet of paper to follow along, that's great. If not, that's okay too. I'll be doing it on the screen.
Let's give folks maybe a second or a minute to grab writing a pen and a paper off, pencil and a paper. I want to give a shout out to Lauren. So this video she's about to show y'all is something that she created, which I think is fantastic. So I know she has an exercise for y'all to do, but just wanted to give her a shout out because it's a lot of creativity, it's a lot of time and effort. So we want to appreciate you as well. And yeah, so I hope that gave you all also enough time to gather something to write on. And back to you, Lauren.
Thanks, chat. Appreciate the shout out. Yeah, so I'll be doing it on the screen too, so no problem if not, but I have to share and share my sound. All right. So this is just a video. Everything's explained in the video, but essentially we're going to be looking at this virtual classroom, and the behavior we'll be looking for is raising hands. And again, I'll point out the target student and what we're looking for. Look for the behavior raising hand. The definition is student lifts one arm and hand vertically above their head. It's not raising their hand if they lift both arms over their head or if they lift one or both arms horizontally to their front or their sides. Observe this student only. I'll keep a tally of occurrences here. Get ready. Awesome. So I'm gonna bring up my PowerPoint again. Oops. All right, so if you guys were following along with my tallies, you should have gotten 6 occurrences of hand raising. And that might have been like just a pretty simple, straightforward behavior to look at. And it doesn't have like all the distractions and questions we might have in the real world when we're collecting data. But I really wanted you to see the importance of really having a good definition of a behavior. So even something as simple as hand raising, like there were a lot of different arm movements the girl was doing. And if I hadn't put the definition and the non-examples on there, it would have been hard to tell what exactly I was looking for. Um, so I included the definition, non-examples, and the target student. And those are just great places to start. There's really like the foundation for any kind of data collection. You want to define it, clarify what you're looking for so everyone who's observing knows, and then of course make sure that everyone's looking at the same student. So I just want to conclude kind of my portion here, and then we'll go to questions. But of course, I want to kind of address why this is all important, why we need good definitions, why we need examples, why we need to know what counts, why we need different types of data. And the short answer to all of these is just that good data, reliable data, accurate data, it's so, so important to behavior analysis. When you're trying to change behavior, you always should be using your data to make your decisions. And that's kind of like a whole nother webinar session. But it's something important to know that data will really be the basis of a lot of your decisions. You need your data to be consistent and reliable and accurate, importantly, so you can see, is this behavior actually a problem? Are your procedures working? Is the student making progress? Are their goals being met? All of these things are things that will be based on your data, and it just makes it really important that we have accurate information to go off of. And again, it makes this content really important and essential to assessing and treating kids. Um, so hopefully this was just a good base of information about what behavior is. Um, I really appreciate your participation and definitely want to engage in more conversation and answer any questions you guys have too.
Awesome. Thank you so much, Lauren. I think that was super informative. And like you said, it's almost foundational
Mhm.
um, to, to the day-to-day work that, y'all as educators and therapists do. But also at the same time, if you do have any parents and caregivers on here, I think that's also important. Because if you are to see a behavioral therapist or any therapist, of that nature to address your child's behavior problems, being able to talk to the therapist and explain, this is what I see in my child. My child has tantrums. Tantrums can look so different to so many children. So really being able to say what a tantrum looks like in your child, and communicating that level of specificity is going to be super important, so that your child can get the best level,
Would it be helpful if I stop my screen for questions? Or...
um, so we did have a question, and Anishka, I know you wanted more clarification on the dead man's test. Was that sufficient enough? What I typed on there?
Yes, actually, I think it was because I was a bit confused. So, so essentially, okay, if the child is like yelling, how would I go about how would I go about using the dead man's test if the child is yelling or shouting and crying? So
Yeah. So essentially, it's just a way to distinguish between behaviors and non-behaviors. And so when you think of a behavior like yelling, screaming, all those things, those are going to pass. So if you're alive and you can do them, then
okay,
those would be behaviors.
yeah,
If that makes
uh,
sense. I know it's kind of weird and unconventional way of thinking about it, but it's how I learned, and I know Chat learned the same way. So
yeah, okay, thank you.
yeah.
So I guess the way I see maybe why people get confused is
Mhm.
because when you describe the behavior, don't put it in a with a negative term. Say the child is not yelling or
Right.
not pinching, because not pinching is something a dead person can do because it comes with a not part. So it's like maybe double negative kind of thing. Sort of, I don't know. It's just that's why it's the way you define the behavior. Don't put negatives in it such that a dead man cannot do it.
Totally. That's
Yeah,
spot on.
yeah, exactly. That's spot on. Yeah, it's like, so if the child is, not yelling, then what is the child doing?
Yeah.
So I think, yeah. So just phrasing it in ways, like you said, it's like the double negative really is the way forward. So I did have another question. Asanka, you mentioned, so passing the dead man's test is the way forward. So this passing the dead man's test is essentially one component that you need to consider when you are creating an operational definition. And like Lauren mentioned, there are some other components that you can add. And the more you consider these components, the more I think you are more likely to have like a solid operational definition. So being as specific as you can is actually the way forward.
Yeah.
Yeah.
But I think, yeah, go ahead if you have another question.
Sorry, no, you finished this. I had another question. So if you,
Yeah, it was just going to relate to what you said with the not running, not things. I think a lot of times when we're speaking to children, if they're doing a behavior we don't like, we say, stop running or don't do that. And so it's just really to say that it can be more effective to say, start doing this instead of stop doing that. It's more effective to say what we want them to do rather than what we want them to stop doing. So that was a great point.
so if I have a question, it will be a bit difficult to type because I'm not sure I'm phrasing it right in my head yet. So today you covered overt behavior and covert behaviors. And from, I think, last session, it was told that anytime we try to address behavior is something observable. Now, covert behavior is something we can't observe. And so technically, if we are trying to have any behavior intervention plan, we are looking for overt behaviors. And so trying to sort of define them precisely and then try to, because quite often we tell children, pay attention, okay, but the kids don't have no idea what attention is. It's like we're talking to them in Chinese, like, right? They're like, okay. So quite often, like when we define things like this, do you understand what I'm saying? Do you listen? Pay attention. Kids haven't, like, doesn't work. It has to be defined to something specific, eyes on the table or something, eyes, listen with your eyes, those kind of stuff. But so today you define behavior as both overt and covert, and last time it was said it was only overt. So I'm just kind of, how do I go about picturing this now?
Yeah, it's kind of a weird distinction, but I think you got the main point spot on in that, we might think of like understanding as a behavior, but that would be covert. It's something inside that we can't see. And people might technically consider that a behavior, but again, you're totally spot on that you're going to want something to be observable. So eyes on your paper, you can't see that they're paying attention in their minds. So that you got the distinction I was trying to make there really, really clear. So I don't know,
Yeah,
Chad.
and also adding to that, so
Thank
if
you.
it's action, then it will be okay. So hands. So essentially, some examples would be hands on the table, bottom on your seat, So again, those are all overt behaviors, and I'm not too sure if Terence, let us know if we are really hitting on your question, because I think your question was, so last week they covered overt behaviors, and this week we're covering overt and covert. And I think the purpose of covering overt and covert was just to, like Lauren said, draw the definitions and tell y'all, yeah, we need to consider overt behaviors and why that is so, because we do have this other thing that we call covert behaviors, where things like understanding, feeling, and those things kind of fall into covert, which we can essentially observe. So think about a step forward, right? When you are creating like a behavioral plan, what are you going to target? Are you going to target increased understanding? Okay, if that's what we're going to target, how are we going to measure increased understanding? Like, so that's kind of where the covert comes into play, and that's why we want to highlight when we are, again, observing, operationally defining, and really creating goals for our treatment plans. We need to always hit the overt part of it, because that's what we can see, and at the end, that's what we are going to measure, and we can measure it because we can see it.
Thank you.
Yeah, these are some great questions, y'all. Just want to see if anyone else has any other questions. Because if not, we can kind of cover the last few slides. So there's one more question. So is there a way of understanding the negative overt behaviors of a kid? So yeah, so for example, some of these behaviors that Lauren covered would be, so spitting, biting. Those are definitely behaviors we would consider negative and inappropriate. And those are still overt. You can see a child bite, you can see a child spit, you can see a child kick. So yeah, again, those are observable. And when we are making treatment plans, okay, when we're making treatment plans, we can really target those. Oh, okay. So is there a way to understand negative covert behaviors? So this is, I think this is where the question is. We want to encourage, I mean, the field of behavior analysis, we really focus on the overt behaviors. A negative covert behavior, you can still see it. There are like ways that there are indicators that you like essentially on the outside that you can observe. So a negative covert behavior could be frustration, right? What are some ways that children express frustration? Like, think about it. Yeah, go ahead, Nancy.
So this is something I've been working with my daughter for a long time. So there are ways to sort of, like, there are tools and like characters you can assign to express for them to identify covert behaviors. Like when you're frustrated, you know how your body feels, and you can use pictures like this. Your body feels tight. Basically, you can teach your child how your body feels when you have these different emotions and feelings. And there's something called socialthinking.com, which has a Superflex series where they have these cute characters called Rock Brain and Glass Man. He has a big reaction for, like when you drop a glass, it makes big sound, and you know, it's a big effect. Even for small problem, you be a glass man, have a big. So my daughter is able to understand these characters, and like there's a brain eater who gets distracted, makes you distract. So now and then they have the opposite characters, the positive thinking ways, the focustron. And so when I use these characters, so what you have to do is you have to bring these abstract, immeasurable things to some sort of form. Like for thoughts, you can use a bubble, thought bubble, and you can put, like, say, I'm thinking chocolate, put the chocolate picture on the thought bubble, put it on your head. So then you're showing your child, I'm thinking chocolate, or I'm like, we use heart for feelings and we put anger there, like I'm feeling angry. So then she was able to visualize, and now we can have conversations like a lot about emotions, and also getting to the point where she's able to self-reflect. Maybe not while the problem is happening, but maybe a bit later, she's able to say, okay, maybe I didn't make the right choice, you know, those kind of stuff. And I mean, Anishka works with her too, and she is able to see that. So, but it takes a lot of time, but we can sort of assign like the different zones of regulation. I'm in the yellow zone, red zone, green zone. So it's like whatever works for the child, we have to sort of figure out how to bring it down to their level so they can identify.
Yeah, absolutely, Taransi. I think you hit the nail on the head. And we talk about these behaviors, and it's important we measure this. It's important, we can observe this, but also at the same time, kind of what you are mentioning is just the importance of social emotional learning. Identifying how they are feeling, and being able to, reflect on those feelings and communicate those feelings. So again, this kind of ties back to, our lab works a lot with, mental health services and social emotional learning, mindfulness training. We work with children, elementary, middle, and high school. And, thinking about, because this whole webinar series is really focused on Sri Lanka, just kind of thinking, kind of the need for those kinds of services in the schools, because yeah, we need to promote, and I think it's just like the model in Sri Lanka, where it's very academic focused, and things like behaviors and feelings and emotions, essentially the holistic child. We don't really, we need to do a better job, really catering to the whole child, in order for children to be successful. But I know that's a whole different line, total tangent, but a very important topic for sure. So yeah, okay. So let me go ahead and switch gears a little bit. All right. So of course there was a Q&A. So for next week, like Lauren touched briefly on this, we are going to talk more in depth about the ABCs of behavior. For all of those who joined us last week, Ashlyn and Mary, we kind of went through an example of the antecedent, behavior, and consequence. That's really what ABC stands for. But for next week, we are really going to dive deep into that, really talking about learning more about the ABCs. Again, kind of continuing the conversation from today about observable, measurable definitions. We'll also talk, I know in the past we've spoken about reinforcement, but something to add to that is differential reinforcement. So this is maybe it will be a new topic for some of y'all, but we'll really touch on how do you differentially reinforce your child to, of course, increase behaviors that we want to see. And another new thing that we'll talk about is prompting. These different prompts. We have verbal prompts, we have visual prompts, we have gestural prompts, we have physical prompts. So really the goal is to help the child learn the behaviors that we want them to perform. So we have Cambria Corsi joining us next week. She is also a graduate student in school psychology here at the University of Utah. So if you are interested, let's see. Oops. This is the link to that presentation. To link to the registration for that webinar. So if you, so that you have it. But for those of you who missed, the second link is the link to the raffle draw. So if you are here today, go ahead and drop in your name and contact information so that we have that. I will be closing the portal once we end this call. So go ahead and drop your names in there. But with that, that concludes our presentation. Yes, I do see Taransi. Go ahead, Taransi. Happy to answer any questions.
So just wondering whether you guys have any other recommendation in terms of tools to help children understand, how do I say, their internal states, like the covered behavior, for them to help understand, like
the feelings and the frustration.
yes. So far, like we've been using, I've been using like the Superflex series and the zones of regulations, and and um, and I think there's a lot of these, like mindfulness, those kind of stuff. But
Yeah, absolutely.
if you have any other tools that help sort of children clarify their, um, internal state, if it would be nice if you can recommend, especially if you guys are using it online, because a lot of our teachers now also do classes online, and reaching out to kids, that might be a good thing if you can suggest some tools.
Yeah, no, I think, yeah, for sure. So we do have a list for sure. And I know, Parency, I do have your email. So I will forward you. And honestly, if anyone on this call needs access to resources, we do have recommended material that we use on all of our kids. And you can kind of pick and choose what works given the age of your child and where your child is in terms of development. And you can kind of cater that, like individualize it on however you want it to, given the need. So I will email you those so that you have those. But again, if anyone is interested, feel free to reach out to me, and I'm happy to forward you all those resources.
Thank you very much.
Yeah, absolutely, no problem. This is the whole point of this series, right? Connecting you all with resources. But let's go ahead and do our tradition where we take a picture of everybody. So I'm gonna stop recording. Let me see, stop sharing. No, actually, I'm gonna keep recording, sorry. So if you wanna go ahead and switch on your cameras so that we can take a couple of hot seconds.
Excuse me, Chathuri. I think there was another question posted by one of the parents. My daughter is just 9 months old. Do you think showing the faces of different emotions printed form will give some indication of identifying various behavioral patterns?
Yeah, thanks for pointing that out, Anushka. So, so I think I just need some clarification. So for emotions, so this is essentially like happy, sad, mad, angry, and it's really hard for us to like model those behaviors, right? Because like those are emotions that children feel. Happy feels different to different people. Angry feels different to a lot of people. So I think a great place to start would be kind of, showing faces. This is how people who are happy kind of show that to the outside world. This is how, people or children who are sad, just like sad face with like tears falling from their eyes. So that is a great place to start. Yes, I would definitely kind of include that in your interactions with your daughter, Asandra. Yeah, I just want to make sure I didn't miss any questions. So thanks for pointing that out, Anushka. You're welcome, Asandra. Okay, awesome. Okay, so let's go ahead and take that picture. I'll give you all a second or two to switch on your cameras. I feel like I'm seeing familiar faces every single week, which is great. We have like people who always attend our session. Okay. So if you don't want to show your face, that's totally fine. Let's do on the count of three. So 3, 2, and 1. Okay, awesome. I'm gonna stop recording. Okay, so thank you so much. Just heads up, next week we will have one more session, and that will be the last session for the rest of the year. We are going to take a break. This semester has been wild for sure. So we'll still see each other next Saturday, but after that, we will see each other, I believe, on the 2nd of January. So we're just going to take a break for 1 week. I hope everyone has a good rest of your Saturday. Stay safe, wear your masks, socially distance, drink lots of water, and have a great weekend, everybody. Thank you so much for